Alright, this is Derek. This is my patient. I'm about to be performing my full head to toe exam. First off, I'm going to take the temperature. Okay, the patient's temperature is 98.5. Now we're going to do your pulse and respirations. Take this over. Okay, patient has a pulse of 90 and respirations of, he has 14 respirations per minute. Now we're going to do the blood pressure. Take first, find, break the pulse. Okay. I'm gonna loosen it up on you a little bit. Okay. Pulse is 124/78, or not the pulse, but the blood pressure. Okay. Now moving on, we're gonna do your hair, or your head. We're gonna start off this way. First off, I'm gonna look at the head, assess the hair. Looking at the hair, I wanna make sure that it looks healthy. There's no missing hair, there's no excess hair. I'm going to check the scalp for any type of lesions. And then we're going to palpate the scalp for tenderness. Any tenderness there?
Nope.
Alright. Following that, we're going to do skin nail assessment. Skin looks healthy. You want to check for bruising, lesions, anything like that. We're going to check the we're going to check the skin turgor here, pinch and release. We want to make sure that it's an immediate turgor, letting us know that the patient is hydrated. We'll do that bilaterally. Okay. Then with the nails, we're going to look at the nails. We're gonna assess them for any like grunginess under the fingernails or any hemorrhaging, splintering. We're gonna do capillary refill real quick. It should be no longer than 3 seconds. Or, yeah. To refill. Okay, good. Then we're going to take your fingers, place them like this. This is Shamrock's test. This is to make sure that our patient doesn't have clubbing or spooning or anything like that. It should be no greater than 160 degrees. This can indicate like a cardiac or respiratory disease. Next, we're going to go with the face. We're going to look at the face. We're going to make sure it's symmetrical in the eyebrows, the eyes, the nose, the lips, the ears, and everything looks like it's pretty symmetrical here. We're going to palpate the superior sinus. Any tenderness there?
No tenderness.
And maxillary. Okay. Now we're going to do the neck. We're going to give the patient take a sip of water. Lean your hip back. Now swallow. We're palpating the trachea, and we're looking at the trachea, making sure that it moves properly. Now we're going to palpate the thyroid. Take a sip of water, please. Lean your head down and to the left. Alright, and swallow it. Okay, and do that with the other side. Okay, good. Also, we're going to palpate for the carotids. Don't ever do this at the same time, your patient will pass out. And the temporal. Alright, now we're going to auscultate the temporal and the carotid. We're going to use the bell of our stethoscope to check for bruits. Moving on to the eyes, the nose, and the throat. First off, we'll start with the eyes. We'll need that. For the eyes, we're going to do, first off, we're going to check perla. I think it's from the side. Checking for roundness, people, all that good stuff. You're going to need you to place your hand between your eyes. We're going to shine the light in one eye. Should get a response in the other eye as well. Good. Good. Okay, next we'll do the cover test. Cover this eye and remove it. I'm checking for lazy eye. Same on the other eye. Remove it. Okay, could you stand up for me, please? Now we're going to do the H test. I'm just going to take this and follow this with your eyes. Okay. Now I'm going to need you to cover up the same eyes as me. There you go. And just tell me whenever you see my fingers come into vision. Ready?
No. 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 No.
Okay. Same with the other eye.
No. 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 No.
Okay. Very good. Let me go ahead and sit back down. The eyes also, we want to look at the conjunctiva, making sure that they're pink and healthy. Don't want any excess exudate, anything like that. I want to look at the sclera and make sure that it's white and healthy. Now we'll move on to the mouth. Actually, hold on, I can grab another stick. Or Tony, that's it. Okay. Say one more time. Checking to make sure that the uvula is rising and dropping. Your mouth one more time. Also inspecting the teeth, the gums, making sure that there's no cavities, no bleeding on the gums. Also the cheeks for ulcers. With the lips, you want to look at the lips, make sure that they look healthy, and palpate the lips for any tenderness there. Okay, you're good. Okay, now we'll move on to the ears. First off, with the ears, let's go ahead and get you to stand up. I'm going to perform the Romberg test. I'm going to need you to close your eyes. Take and pick 1 foot up and spread your arms out. It's just assessing the patient's balance, making sure that their cranial nerve 5, I think. We'll assess those in a minute. Okay, you can go ahead and sit back down. Now we'll go inspect the ear. First off, you want to palpate the auricle, which is the upper ear, and the tragus right here on both sides. And taking the otoscope. Lifting the ear, pulling it back. Gonna look inside the ear for any lesions, any thing done. Okay. When I look in the ear, I need to check the eardrum, make sure that it's a pearly gray color, which is healthy. I want to check for any bleeding, any hemorrhaging, any perforation to the eardrum, anything like that. Okay. I'll start with the Renee Weber test. This is a test, bone conduction and air conduction. Strike the tuning fork, place it on your forehead, and tell me if you hear it more in one ear or the other.
It's even on both.
Okay, good. Alright. Now I'm going to strike it again, place it on the back of your ear. I want you to tell me when you stop feeling it on the back of your ear, and then I'm going to move it beside your ear, and you tell me when you stop hearing it, okay?
No.
Okay. Oh, God. This is that. Hold on. Let me try that again. Let's do that one more time.
No. No.
Okay. Well, that was a little bit shorter than I like, but that was about 8 seconds of bone conduction and 12 seconds of hearing. Okay. We'll do that on this side as well.
No. No.
Yeah, about 8 and 12. look up inside of the nose. We're gonna look at the turbinates and the septum. We want to make sure the turbinates look healthy as well as the septum. We want to make sure the septum isn't deviated or that it has any perforations. You take your nose, place it over your finger, take your finger, place it over your nose. Good. Okay. Opposite side. Okay. Just gonna make sure that you can able to smell. Alright. Could you close your eyes for me, please, sir? Cover one of your nostrils. Tell me what you smell.
It's kind of like a sweet taste, I guess.
Yeah, it's vanilla. Okay. And cover the other nostril.
Oh, it's still
Okay, yeah, there you go. Alright, let's test an olfactory nerve, cranial nerve 1. We're done the head, the ears, the eyes, nose. Okay. Now we're going to move on to the thorax. First off, I want to inspect the chest. Yes. Could you stand up for me real quick? Turn around. Alright. Take a deep breath. Okay. Checking is expansion, making sure it's symmetrical on both sides. You can sit down. Also, I'm gonna do the check his tactile firmitis. Just say 99.
99. 99. 99. 99. 99.
Okay. Now, after we've done this, we're going to take and I'm going to percuss wherever that area is. I'm just going to okay. Now I'm going to auscultate. Okay. I'm going to just take a deep breath whenever you feel my stethoscope on your back. Okay, very good. There we're just checking your lung sounds. I'll listen to the tracheal, bronchial, bronchovesicular, and vesicular lung sounds. Also, I need to do the egophony every time you hear, or every time you feel my stethoscope on your back, say E.
E. E. E. E. E. E.
Okay, very good. Now, if there's some sort of, if there's something wrong, you'll usually hear an A instead of an E. I believe it might be pleural effusion. One's in this too. 4x. Okay, let's start on the heart here. With the heart, we're gonna take and first I'm gonna palpate, see if I can feel your pulses. Also, you gotta know these pulses is radial here, brachial here, temporal, carotid. You got your femoral. You got your dorsal pedis on the front of the foot and tibial, posterior tibial, and on both sides. Now we're gonna mark you off.
Okay.
Okay. First, at the second intercostal space on the right side is your aortic valve. And directly across from that is your pulmonic. Third, let's see if I can feel it on you. Third intercostal space is Erb's point, and that the fourth is tricuspid. There, somewhere. There we go. And a little bit further from that is your mitral. Okay. Let me close this up. Okay. Now I'm going to auscultate these areas. On the aortic and pulmonic, I should hear the S2 louder than the S1. Erb's point, I should hear them both equally. And at the mitral and tricuspid, I should hear the S1 louder than the S2. We'll take those off of you. Okay, good. Okay. Alright. We've done the chest. Set this out of the way. Can you turn and lay down on your back? Supine position. Alright, looking at the abdomen, you want to look at the abdomen and you want to divide it into 4 quadrants using the umbilicus from the midline. It'll be right upper, right lower, left lower. Alright, first off, I'm going to auscultate for gut sounds. Okay, good. After that, I'm going to percuss over these areas. Okay, I should hear some timpani, usually in the left lower, on your last bowel movement.
Earlier this morning.
Okay. There, you can hear the dullness there.
Mm-hmm.
Now I'm going to percuss the liver. Liver should be no more than 6 to 12 centimeters. So, start here. Find that one more time. Should liver border. Now we're going to palpate each quadrant. Deep palpation, I usually use 2 hands, but since I'm a big guy, I'm just going to use one. 3 centimeters each quadrant. Any pain, anything like that?
No.
Okay. I'm going to palpate the liver now. I'm going to take this on, put it behind your, okay, there you go. So hand right here. Just take a deep breath and exhale. Okay, good. I can feel it, so that's a good sign. Now, you're going to palpate the spine. Palpate the spine, which is good. Also on the abdominal, I forgot, I need to auscultate the abdominal arteries with my bell of my stethoscope. Starting with the aortic right here. Checking for bruits. Renal. Iliac crest. And the femoral also. We're not going to do the femoral. Okay, you can sit up. You take this tape off real quick. Okay, now that we've done that, we're gonna do, I believe neuro. Okay, with neuro, first off, where are we at right now?
We're in the nursing building
Where at?
at Troy University.
Okay. When is your birthday?
March 6, 1992.
Okay. Who's the president right now?
President Obama.
Let me say 3 words. I want you to recite them to me later on,
Okay.
whenever we get a little bit further. Duck, squirrel, turtle. Okay, just remember those 3. If you're in a burning building, what do you do?
You get out.
Okay. If you say having all your ducks in a row, what does that mean?
Just having everything together in order.
Okay. There we're assessing his present, past, future, his memories, basically. Also his abstract thinking with the ducks in a row thing, and his logic with the getting out of burning building. Now we'll, what are those 3 words that I asked?
Duck, squirrel, turtle.
Okay, very good. That's his recent memory. We'll make sure that we cover that. Now I'm gonna have to refer real quickly. Yeah, okay. Now we'll do the tests. First off, close your eyes. Tell me if this is. Just tell me where you feel this. It's gonna be soft touch.
It's on my face. My shoulder. chest, forearm, side of my knee, and down my shin.
Okay, very good. Alright, now we're gonna do sharp and dull test. You just tell me if this is sharp or if it's dull.
I feel sharp,
Okay.
dull, sharp, sharp, dull, sharp, dull.
Okay. Very good. Close your eyes again. Open your hand. Tell me what I'm placing in your hand. This is
That's the key.
strong. This is okay. Very good. And what is this?
Paperclip.
Yeah, very good. Alright. Turn your hand over. I'm going to write a letter or number in your hand, and you just tell me what that is.
3.
Okay, very good. Well, that's graphthesia. Now we'll take and could you stand up? I assessed the gait of my patient when he walked in. Can you take and put your arms out like this, lean your head back, touch your nose, touch your nose. Very good. Okay. Now we're going to do tandem walking. Just want you to take one of these lines and just heel to toe down the line. There you go. Okay. Now sit back down. You take your hands, supination, pronation. Rotate your hands real quick for me. There you go. Can you take your foot and make a figure 8 for me? Other leg too. Good enough. Okay, there's that. Now I'm going to incite your deep tendon reflexes.
Okay.
Alright, first off, you're gonna do your radial. Just let your hand lie. There you go. Can you raise your hand up against me? Very good. No, just relax. See that small jump? Okay. Do this on this one. Pull up against me. Okay. Okay, there we go. Now, brachial. Could you stand up for me, please? Brachial. Place your hand up under there. Now, could you lift up against me? Okay. Very good. You just take and rest your hand. You got your weight. There we go. Get the brachial reflex. Alright, now tricep. You're gonna lift. Push out against me. Okay, very good. You got your weight. Let's do that one more time. Push out against me. Okay, there we go. Okay, there we go. Now, sit down. You're gonna get a patellar reflex. Push out against me. Okay. Straight into the legs. Oh, this one will be better. Alright, can you roll over and lay on your back, or lay on your stomach on the bed? That's your feet. Okay, scooch down a little bit so that your legs dangle off. Okay, very good. It's Achilles tendon. Make sure that we're getting this one just a little bit catawampus. Okay. Achilles is right here. Just relax. Okay, very good. musculoskeletal. First off, palpate the muscles. Sure. No tenderness. Muscles and joints. Very good. Now we're going to test your muscle strength right here. Just take and push in against my hand. Very good. Push out. Very good. In. Out. Very good. And push against my hand. Good. Pull. Good. Push. Good. Pull. Good. Okay, stand up and turn around for me, please. Check the spine. On it. Like this. No tenderness, anything like that. Okay. Very good. Okay. Well, now we're just going to do the cranial nerve test. Well, one, we did the olfactory already with the smell test. Two was done with the H test, which is your visual acuity. 3, 4, and 6 were also done with the Perla and all that. 5, your trigeminal. Can you clench your teeth for me real quick? Very good. Okay. 7 is the facial. Can you smile, frown, puff out your cheeks? Okay, very good. We'll skip around a little bit, sorry. 12 is hypoglossal. Push your tongue against your cheek in my hand. Stick it out, wiggle it. Okay. 11 is your accessory. That's just your trapezium, all those muscles. Can you shrug your shoulders? Pressure against my hand. Against my hand. Okay, very good. 10 is your vagus, which is your gag reflex. We're not gonna do that to him. 9 is glossopharyngeal, which is I could do with the taste test, but we're not gonna do that one. 8. I'm gonna have to look back real quick. 8 and 9 we've already done. Or well, 10 the vagus is where he swallows. 9 is the glossopharyngeal, which is the taste, and the 8 is the vestibulocochlear, which is the Romberg's test. Any questions?
No.
Alright, I think that's it for me. Thank you guys. See you later.